What causes pain in the back of the shoulder? This area has many potential areas of crossover pain from other structures like the spine, making it challenging and difficult to diagnose the problem. In today's video, we will be discussing 2 common and 2 uncommon causes of pain in the back of the shoulder. If you're new here, welcome to the Shoulder and Arm Health channel, where we discuss the latest and best in shoulder and arm care. The medical term for this area is the posterior shoulder. It is made up of several important structures such as the shoulder blade or scapula. The shoulder blade has one bony connection to the rest of the body here at the clavicle at a joint called the AC joint. The rest of the scapula is connected to the rib cage with a series of muscles. We could spend all day talking about the scapula and its complexities, but I'll just point out a few important structures. This muscle is called the serratus anterior. Along with several other important muscles in this area, the serratus anterior plays an important role in stabilizing the scapula. This is the subscapular bursa. It is a small, filmy sac of fluid that lubricates the boundary between the scapula and the rib cage. These muscles here make up the rotator cuff. We have talked previously about the rotator cuff and specifically the subscapularis and supraspinatus muscles when we were discussing pain in the front and the side of the shoulder. The 2 muscles in the back of the rotator cuff, though, include the infraspinatus and the teres minor. These muscles are involved in external rotation, so think about like a tennis backhand motion or when you're reaching upward. They're really important in those types of motions. And finally, here's a structure called the suprascapular nerve. This important nerve passes over the top of the scapula and under a ligament called the transverse scapular ligament. This nerve controls the rotator cuff muscles we were just discussing. Its anatomy makes it prone to kinking or compression by the overlying ligament. If you watch to the end, I'll come back to this nerve and the unique problems it can cause. If you look just upstream to this nerve, you will find the nerve roots of the brachial plexus as they exit the cervical spine. So let's start off by discussing subscapular bursitis. As I mentioned, the subscapular bursa or bursae are several fluid-filled sacs under the scapula. These lubricating boundaries are really important because without them, there would be a lot of friction between the shoulder blade and the rib cage, which is just underneath it. Due to various causes, including bad abnormal scapular motion or repetitive injuries to the area, the bursa sac can become inflamed and thickened. We call that bursitis, or specifically subscapular bursitis here. The shape of the scapula likely contributes to the irritation in this area. If this happens to your shoulder, you would experience pain in this location right here. The pain can be a bit vague, but in general it will be medial or toward the midline from the edge of the scapula. Treatment for this condition starts with focusing on good scapular mechanics. A good physical therapist will be able to help you strengthen the supporting muscles of the scapula, like that pesky serratus anterior we were just discussing, as well as the trapezius muscle up here on the top of the shoulder. Most people improve with a focus on good scapular mechanics. Occasionally, though, for really persistent cases, a surgical removal of adhesions can bring the needed relief. Next on our list is rotator cuff tears. I've spoken about rotator cuff tears in a previous video. Although these injuries can cause pain in the side of the shoulder, they can also be responsible for pain in the back of the shoulder, especially if the tear involves the infraspinatus muscle. These tears are most common in people over the age of 35. They can be full thickness or partial thickness. Even if the tendon only has a partial thickness tear, it can be just as painful as a full thickness tear. These tears usually happen due to rubbing of the tendon on the overlying roof structure. As the tendon loses thickness, it can also begin to weaken and become more susceptible to a full thickness injury. As a result, the tendon can finally snap during an activity that might have been well tolerated by a healthy tendon. I've made a video about the options for partial thickness rotator cuff tears, and I'll put a link in the description below. In general, these types of injuries will often respond to physical therapy. Therapy will not cause the tendon to heal, but it will often improve the mechanics of the shoulder, reducing the rubbing and abrasive damage to the tendon. Other options include PRP or platelet-rich plasma or hyaluronic acid injections. Next on our list is the suprascapular nerve. The suprascapular nerve can cause quite severe symptoms in the back of the shoulder. Unlike subscapular bursitis, which causes pain here, pain from the suprascapular nerve is right here, more laterally in the shoulder blade. As we discussed in the anatomy introduction, the suprascapular nerve can become either compressed by swelling or kinked by bad shoulder blade mechanics. This can be accentuated by a torn rotator cuff when it retracts, causing the nerve to hang up on the overlying ligament. I've even treated people with a rare anatomic variation where the overlying ligament becomes fully ossified, meaning it turns to bone. So rather than the usual arrangement, the nerve passes through a tight little hole in the bone. This can be seen on an X-ray if you are looking for it carefully. This problem can also occur due to a cyst that forms here called a spinoglenoid cyst. That type of cyst is usually caused by a condition called a slap tear, which we've discussed in a previous video. Suprascapular nerve compression can be very frustrating because the pain feels like a nerve-like pain, or in some cases like a toothache pain that can't be alleviated by stretching, and you can't get to it by any other means. Unfortunately, without the right diagnosis, patients can suffer for a long time or undergo surgeries for the wrong cause, leading to persistent symptoms. When I suspect this condition, I can usually diagnose the problem using a test called an ultrasound-guided suprascapular nerve injection. This test takes about 10 minutes to perform. We use an ultrasound machine to see the notch of the scapula and then inject a numbing agent called lidocaine, as well as a longer-acting steroid. If this alleviates the pain, we are able to know with some confidence that the nerve is the cause of the pain. In some cases, the injection itself can give long-lasting relief. However, in most cases, the pain can return after a few weeks. In those cases, an arthroscopic suprascapular nerve release can be quite effective at relieving the pain permanently. And finally, I should discuss neck pain here. Many people who have had various sports or other types of injuries can develop a disc herniation in the neck. The most common place is in the C5-6 level. Pain from this disc tends to radiate downward into the territory normally innervated by the C6 nerve root. So if you look in this picture, the pain would be right about here and down into this area. This is quite similar to the symptoms from subscapular bursitis, as you may remember. However, in addition to the pain, people with neck issues usually complain of numbness in the hands. That numbness is a unique feature of neck problems and helps us to know that that's the problem. Although some of these issues will require a surgery eventually, many patients improve just by starting with a good scapular stabilization or other physical therapy routine. For those who do not improve significantly after physical therapy, the right surgery can often give the needed relief. In a future video, I will discuss the suprascapular nerve and how we release it surgically. If you found this information helpful, please give the video a thumbs up and consider subscribing to the channel for more content brought to you by an orthopedic surgeon. That's me. Take care of your shoulders, and we'll see you in the next video.